Have you ever felt like your body was sending you signals, but no one could crack the code? Misdiagnosed conditions are more common than you think, and they can leave patients feeling frustrated, confused, and overlooked. In today's video, we'll explore the top 5 most commonly misdiagnosed conditions, what's really happening inside your body, and why these cases often slip through the cracks. So, stick around because the answers might surprise you, and could even change the way you think about your health. Number 1. Fibromyalgia. Fibromyalgia, a condition that feels like your body's alarm system is stuck in overdrive. It causes widespread pain, extreme fatigue, and sensitivity to touch. But here's the problem. It doesn't show up on X-rays, blood tests, or other standard diagnostics. What happens in the body? Fibromyalgia is believed to involve how your brain and spinal cord process pain signals. Imagine turning up the volume on your stereo until even a whisper sounds like a shout. That's what's happening to pain signals in fibromyalgia patients. Why does it get missed? Because the symptoms overlap with conditions like arthritis, lupus, or even depression. Doctors may dismiss it as stress or mental health issues, especially if they can't find visible inflammation or damage. How to get it right? If you're dealing with unexplained pain and fatigue, ask your doctor about fibromyalgia. A rheumatologist can rule out other conditions and make the correct diagnosis through detailed symptom evaluation. Number 2. Lyme disease. Next we have is Lyme disease, often called the great imitator. It's caused by a tick bite that transfers the Borrelia burgdorferi bacteria into your bloodstream. Without treatment, this bacteria wreaks havoc on your body. What happens in the body? Once the bacteria enters your system, it can cause flu-like symptoms early on: fever, fatigue, and joint pain. But if left untreated, it spreads to the nervous system, heart, and joints, mimicking conditions like multiple sclerosis, rheumatoid arthritis, or even chronic fatigue syndrome. Why does it get missed? The bullseye rash, the hallmark sign, isn't always present, and blood tests can give false negatives in the early stages. Doctors often focus on individual symptoms without connecting them to a tick bite, especially if the patient doesn't remember being bitten. How to get it right? If you have persistent symptoms and live in or have traveled to a high-risk area, mention it to your doctor. Advanced testing and early treatment with antibiotics can prevent long-term complications. Number 3. Irritable bowel syndrome, IBS. IBS, a condition that causes abdominal pain, bloating, and unpredictable bowel habits. It's often dismissed as food intolerances, anxiety, or even just stress. But there's more going on beneath the surface. What happens in the body? IBS is linked to how the gut communicates with the brain, a two-way conversation called the gut-brain axis. In IBS, this communication gets disrupted, leading to an overactive gut that reacts strongly to normal triggers, like food or stress. Why does it get missed? Its symptoms overlap with conditions like celiac disease, Crohn's disease, and lactose intolerance. Standard tests like colonoscopies may come back normal, leaving patients without answers. How to get it right? Seek the doctor's help and keep a food and symptom diary. Identifying triggers and ruling out other conditions are key steps in managing IBS effectively. Number 4. Adult ADHD. Coming in at number 4 is adult ADHD. Yes, you heard that right. A condition often misunderstood and overlooked. While we think of ADHD as a childhood issue, many adults live with it undiagnosed. What happens in the body? ADHD is linked to differences in brain activity, particularly in areas controlling focus, organization, and impulse regulation. Imagine trying to drive a car with brakes that only work half the time. That's how the ADHD brain struggles with self-control. Why does it get missed? Symptoms in adults, like procrastination, forgetfulness, or difficulty managing time, are often blamed on stress or anxiety. Doctors may focus on individual symptoms rather than looking at the bigger picture. How to get it right? If you've always struggled with focus and organization, especially since childhood, consider an ADHD evaluation. Treatment options like behavioral therapy and medication can make a big difference. Number 5. Polycystic ovary syndrome, PCOS. Last but not least is PCOS, a hormonal disorder affecting 1 in 10 women. Symptoms include irregular periods, weight gain, acne, and excessive hair growth. But these signs are often dismissed or misattributed. What happens in the body? PCOS occurs when ovaries produce too many male hormones androgens, disrupting ovulation and hormone balance. It's also linked to insulin resistance, which can lead to weight gain and difficulty losing weight. Why does it get missed? Symptoms vary widely and overlap with other conditions, like thyroid disorders or simple hormonal imbalances. Many women are told to just lose weight without further investigation. How to get it right? If these symptoms resonate, request a hormone panel and an ultrasound. Early diagnosis can help manage symptoms with lifestyle changes, medications, or hormonal therapy. These conditions highlight how complex the human body is and why medical mysteries can take time to solve. If you're feeling dismissed or overlooked, don't hesitate to ask questions or seek a second opinion. It could make all the difference. After all, your health deserves more than just a quick guess. It deserves a thoughtful diagnosis. If you found this video helpful, give it a thumbs up and share it with someone who might benefit. Don't forget to subscribe to Healthscopic and hit that bell icon for more in-depth health content. Comment below if you want a detailed video on any of these conditions.